trying to do what everybody else doing, just cause everybody doing what they all do. If one thing I know,
good morning, ladies and gentlemen. I've been to Bangalore several times before, but this is the first time after an incident that happened in my life. See, my father was a Jat Sikh from Punjab. So if you're a Jat Sikh from Punjab and you got educated, and the only option that you have is join the military. So he was stationed in Bangalore when he first started. But 20 years later when he retired from Bangalore as well. So this is two connections that I have to Bangalore. And third, and last year he passed away. And I explained to him what I do for a living. And he understood for years that I was an engineer and I did all kind of things, but I really never really had a time to sit down and talk about it, what it is that I really do. So I explained to him what I do in healthcare. And this is the night before he passed away. And he looked at a clock in the room in the hospital, and he said, "It's 9 o'clock. You better go, because you have a job to do." So this is my story. So I'm going to share with you. I'm not going to talk about architecture diagrams and those kind of things. That's what you already know how to do this, and a lot of speakers have covered that. Canwell covered it really well. So this is more of a human side of the enterprise architecture. So this is more of a personal story and what it is that I'm doing and why am I doing it, and some lessons to share with you. What do you do as an enterprise architect? Now, one thing that you're going to take away from this presentation is that architecture is not about drawing boxes and arrows. Anybody can draw boxes and arrows. That's not what really matters. What matters at the end of the day, did you make a positive change somewhere? If it didn't happen, you have perfect architecture. You're the only one who thinks it's perfect. A lot of people before you drew those boxes, it didn't matter. So this is the story. So I'm going to share with you about disruptive changes in how do you manage disruptive changes, and make sure that when you create a disruptive change, that doesn't disrupt what you're changing. Healthcare is one of those industries where disruptive change is needed. But if you make uncontrolled disruptions, consequences are not nice. People die. That's not necessarily an easy thing to swallow for anybody, let alone a professional healthcare provider who has to go tell the family that it didn't work. So I wanted to share with you is the reason why we're doing disruptive changes. And if you look at it, from hospital-acquired infections, this is the U.S. alone, over 100,000 people a year die because they acquired an infection that they didn't have before. So they acquired some sickness in the hospital that they didn't go into hospital with. And there are a number of them that are causing most of these disruptions. And the cost of these disruptions, these hospital-acquired infections, is horrendous. That's in dollars, but if there is an even larger cost that is in human sufferings, that is unnecessary, that could be avoided. So the journey that I'm going to take you for the next 40 minutes is to, what did we do to help to address this problem? What did we learn from it? What are some good practices that we followed? And see if any of those good practices could be applicable to you. So the objective of this presentation is to share with you 7 good practices. And I'm going to tell you what that good practice is, and what did we do, and how did we apply this to our specific case scenario to address those hospital-acquired infections. And what we learned from it, and the secret to success. Now, we're not finished with the job yet. The job just started. The work of addressing the hospital-acquired infections has just started. So this might take another 40 years. So I got all the time in the world that you can think of. So I'm not going anywhere. So I have a long-term plan. So, so if it takes 40 years, so be it. At least it will get done in 40 years. So at the end of the day, I wanted to give you some takeaways and some action plan that you can do if you have aspirations to become an enterprise architect. And in this afternoon, we have a workshop that are some of the stuff that we're going to talk about here. I don't have a time to go into detail, but in the workshop this afternoon, we'll go through a lot more detail exactly how do you actually do it. So here's the 7 good practices. Now, there's nothing radical or rocket science about it. And the first thing is that if this is not a most common sense thing, is to identify the problem right. Just because somebody said they want a system does not necessarily mean that's the problem to solve. So you have to take steps to find what is the problem to solve. Now, once you identify the right problem to solve, this is when you actually create a disruptive change. Now, if you want to minimize the impact of the disruptive change, make sure you solve the whole problem, not only part of the problem, not from a specific stakeholder point of view. So you have to address the problem from all the stakeholders' point of view. So that just changes the dynamics and economics and architecture work that you do. And next thing is that you want to communicate and engage. Writing a presentation is not a communication. You have to engage people. And people will engage with you if there is a reason for them to engage with you. And culture of transparency and accountability, it has to be part of your architecture to create a transparency throughout. Not throughout the architecture or through the implementation, through the life of that capability. Build the right levers in your architecture so that architecture itself could evolve over the next 10 years. Because whatever you build isn't going to go away tomorrow. So it's there to stay. So you have to put some right levers in it. So how are you going to change it over time, and how are you going to improve it, and how is it going to be adopted by people? And next thing is that you got to put a human stamp on what are you doing, because if you don't put a human stamp, there is no relationship. At the end of the day, we as human beings are more intended to be relationships. So an architecture, there has to be some human stamp in it. And last and most importantly, enterprise architecture is a profession, and by God, start taking responsibility for what you do. So over the next few slides, I'm going to walk you through each one of those. What do I mean by them? So here's the overall visual of the 7 best practices. So what you can do is, if you take those good practices, now I don't mean to claim to be best, I don't mean to claim those are the only ones, the list of good practices, and you create a capability, you have a current performance, you have target performance. At the end of the day, it all perhaps would become about a simple touch. But most important part for you as an enterprise architect, you need to understand what those practices are, when to apply it, how to apply it, and most importantly, in what intensity to apply. Because if you don't know what intensity to apply them, you don't understand that practice. So this is a lifelong learning experience for you, is to learning those good practices and how do you apply them, when to apply them, and what intensity to apply them. So first challenge comes to identify the problem right. Business requirements, as we know today, do not tell you anything about the problems that you're solving. They tell you a lot about the solutions characteristics, but not much about the problems characteristics. To do this thing, we have tools. So I'm going to take you this through. We have an ADM we call the architecture requirements. Truly applied architecture requirements tell you a lot about what the problem you're solving. And if you apply, the whole concept in architecture requirements was embedded from the system thinking. So if you think about it from the left to right, this is what you should do, but from right to left is what we normally do. We have a little bit of information about something, we jump to a solution, and next thing we spend the rest of our life trying to fit that solution to the problem. Basically, at the end of the day, you come up with unconditional compromises. So at the end of the day, would you have a solution? It's just endless compromises that you come up with. There is things that they put into project management, and it's called things that are out of scope. How could they be out of scope if they're part of the problem? If they're not part of the problem, why are they even on a piece of paper? That have nothing to do with you. So the way the architecture requirements in ADM work, the way you sort of analyze them, you look at from the left side, you look at what are the salient characteristics of the problem from each individual stakeholder's point of view. Then you do the causality of it. If I address that problem, that problem will be solved. Then you do the architecture of the whole. Once you've done the architecture whole, then you actually have a very creative way to resolve tension between various things. That is a system thinking. This is not something that we made up last week. This is about 100-year-old science. So it's proven, it works. It's been used for 100 years. So this architecture requirements that tell you how to solve, what exactly is the problem to solve. Apply system thinking to understand truly what the problem to solve is. So when we applied this whole concept to our problem in healthcare, we wanted to improve hospital-acquired infections, that is improving healthcare quality. If you wanted to improve healthcare quality, one thing that you can find out for sure is the people who are in healthcare, they are a unique set of people. If it's not working, it is not because they're not working hard enough. So what you have is, you think about care quality, it is a function of how engaged are they. And to engage staff, transparency and accountability becomes important. So if you frame the problem that way, we know how to solve that engagement problem. We've done that before. So now it becomes if you want to improve healthcare quality, your problem to solve is to engage the frontline staff. So problem to solve is to engage the frontline staff. And in order to engage the frontline staff, now you have a very tough choices to make, because there are going to be things that people are going to ask you as a part of your solution that you need to put them in. They have nothing to do in engaging with the frontline staff. It has everything to do giving management the control so they can put draconian measures on people. That's not going to engage people. So you have a responsibility as to what requirements that you're going to handle, what you're not going to handle. So next thing is solve the problem whole. The whole problem, not just part of it. So through the architecture requirements, we are going to find a lot of conflicting requirements from various stakeholders' point of view. More conflicting the requirements, a better value the architecture is going to deliver. If everybody agrees to what the obstacles to address are, problem is a lot easier to solve. So what are you going to do is now through ADM cycle, we have this strategic segmenting and capability iterations. And you're going to apply those iterations at each level using ADM phases. At a strategic level, whether it's a strategic or segment or the capability level, ADM applies the same way. So at a strategic level, you have to be aware of what are your phase H, what we call in ADM, those of you know it, is how you're going to support and leverage this capability over life of it. So if you can't figure out how you're going to leverage it and support it through in a strategic phase, it's not an architecture. It only addresses part of the problem. So ADM gives you perspectives. It gives you, say, if you're doing strategic architecture, make sure the entire ADM lifecycle perspectives are considered. So when you move down to segmented, and the portfolio architecture, then you still are looking at implementation and support and the capability of it. So it's not just architect this thing, hand it over to somebody else. So you have to be aware of, over the next 10 years, how this architecture is going to evolve. If you don't have an answer to that, you haven't done the complete architecture. So that's how you solve the whole problem. Looking at the problem to solve is, how are you going to get on a solution and implementation or anything else? Half the people, as you start going on the roadmap, you start losing those people. Because as soon as the people realize this thing isn't doing anything useful, they get off your boat. And so how did we do this in our healthcare thing? We looked at 4 different capabilities we wanted to do. The first thing we wanted to do, this is an age-old total quality assurance program. First thing, you measure the process variance. People are doing stuff and they say, measure the process variance, then you measure the quality of the product that they're making, and then thirdly, think about it, does it matter? So we did the same thing in this program. When people are providing different functions, see how close are they to best practices. If there are 97, 95% close to the best practices that the guidelines already exist, it's called a checklist. And then go in there, take a look at the patient. Is that patient is being provided best service according to guidelines? And the third thing you look at is, has that patient acquired an infection? So you have 3 real-time measures coming to you, positive reinforcement. So if people are not delivering the right service, then you've got to give them the tools to actually improve their capability. So this is where the education comes into place. Close the knowledge gaps. They have to be done in a positive way. And once the knowledge gaps are closed, then you engage them actively. And most importantly, lastly, then you think about transparency and accountability. That's just a simple right dashboard. Tell me what's important. Convince me it's important. Then show me how we're doing it. And what can we do to correct it? Because people generally go to work to do the job right. So that's solving the problem as a whole. Communicate and engage. Overall, we found that this was a Gallup poll survey that was done recently. 75% of the workforce is disengaged at a workplace. That's not engagement. So when we are communicating and transmitting a complex information, engaging people is about involving them, attracting them, and building meaningful connections. That's what that means. So when you do an architecture, it becomes a lot about you as a person. Tools exist, methods exist. They're there for you to use, repeatable, but there is always a human touch. So that's how you're going to communicate and engage people. And when you're engaging people the right way, and there's a very good model that exists in a lot of literature, is that on the bottom axis you look at the extent to which people agree, the cause and effect. Do I agree that this cause is valid, and the approach that we're doing is going to solve the problem? Do people agree with you? On the y-axis you think about it, what's in it for me? So if you have people on the lower left corner where they don't buy into the argument and they're not with you, there's nothing in it for them, they're not going to be engaged. So your idea is to move those people to the top right side, and now your architecture problem is to how you're going to take somebody moving from the bottom left side and move them to top right. That's the architecture problem to solve. Your problem may not be technology. Your problem might be people. That's still part of your problem. Because if you're solving a technology problem, you're doing technology architecture. If you're doing enterprise problem, if you're solving enterprise architecture problem, you're solving the entire thing, whether it's a people, process, or technology. So that's how you're going to solve the people problem, by engaging and communicating. What did we do about it? And we put in the focus, in our understanding, was that put the focus on the person who's the most important, is a bedside nurse. And everything from that point on matters what matters to the bedside nurse. If it doesn't matter to her, then it's not in it. If it matters to him or her, then it's in the scope. We're talking about engagement of this knowledge worker and giving them the right set of tools and processes and controls to do the job. Transparency and accountability. Now, when we talk about transparency and accountability, it's not all about corruptions. You can actually become a very transparent and accountable organization within what you're doing, within a capability. But the most important things happen when you do this architecturally inside your program. It's by architecture, it's not by design, it's not by coercion. So it improves sustainable engagement. Because you can engage people today, but if transparency and accountability exists, is that sustainment becomes a long haul. So people stay engaged. The governance it's a fairness. There's a governance principle called fairness. If your governance is not fair, people will not follow it. So if there are one set of rules for the nurses, another set of rules for the doctors, another set of rules for management, that's not a transparency and accountability. That's just basically saying, I want transparency, but as long as it doesn't apply to me, I'm okay with it. So it has to be entirely from top to bottom. And transparency and accountability helps you deliver results. And most importantly, helps you tap into people's creativity. You'll be amazed what you find if you have an engaged workforce. So what we did, we just simply created a performance dashboard that was real time. What measures people mattered to people? There was 3 measures. 3 measures that mattered to them. We created 3 measures and put them on the dashboard, and they were updated every 20 minutes. So once you update them every 20 minutes, and next thing you give them and say, for individual who logged on to the system, and he looks at it and say, what was my performance for the last 12 months? What was my performance this month? And how am I doing this cumulative month? So for example, if my performance was 75% of the last month, last 10 days have gone by in this month, I'm hovering around 72%. That means I got to get my act together to move up. You'd be surprised how actively people engage when they find out that their performance this month is actually worse than last month, but they have a room to correct. Because if you tell them what the performance number was 2 months later, it's too late. What am I going to do about it? You give me an opportunity to correct it. Right levers. Your architecture needs to have right levers to create it in a way that over time you can incrementally build that capability and support it. You don't have to do, architecture is not a one-shot deal. So you build it in a way that you leverage over time. So you got to build the right mechanisms in it that incrementally people can actually get better at it. This is not a one-shot deal. So like when we first initially did this whole program, we found out that on the average, compliance of variance was people were following good practices that are documented. Documented good practices about half the time. So if you're following only good practices half the time, you have no idea this patient didn't get better because the diagnosis was wrong, the treatment was wrong, or we just followed it wrong. Or people just didn't do their job. So this is kind of what happens to us, is that when we sort of start thinking about it, when you're architecting something, think about a minimum viable product that you can create, and then the next set of functions that you can add to it. And over time, how are you going to leverage it? Because this is a part of your architecture. Your architecture isn't to create all 1,000 functions in 1 week or one go. You think about it, what is the absolute minimum, how you can add to it, and how you can leverage it over time. And one of the things that you're trying to do, you're trying not to let the client go back to the last bucket. Because if they start going into that area, because that's where you really need to rethink your architecture again. So what we did with this thing was very simple. We created a set of functionality that people can use. And then from after that, now they know their variance is 50%. And then the only way to close the variance is, one of the ways is to close the knowledge gaps. Let people be educated and trained in real time at the bedside. 20 minutes, 15 minutes. Because one of the things that we found out when I followed, because one of the things that I did when we were doing this program is that I scheduled time with the nurses, and they're working from 7 to 7, then I followed them the whole day. See what they did. Just observe what they're doing. Just like do whatever, just be in the presence, but not interfering with anything. So what I found a lot of times is that on the daily basis, nurses have 5, 10, 15-minute windows of time. It's uncontrolled. You don't know when it's going to happen. It happens during the whole day. So now you have to think about it. How are you going to leverage that 5, 10, 15 minutes? So what we did with this thing, basically give them 5, 10-minute windows to learn. So once they got education, and next thing is that person is learning, but next, and also another very important thing that they have to do is that in order to get a professional credits, so they have to get professional credits in order to keep their licenses. So what a great mechanism if you take what they're doing and convert it into their professional credits. Now you have a perfect engagement. And people are doing, then it's a reward system, works very well. You can get loyalty points. So all those things people do, you give them loyalty points. And you get them to convert those loyalty points. If people aren't interested in loyalty points, they're just interested in how you're doing compared to the other people. So what this does at the end of the day for us is that when incrementally building this capability is architected once, but it's built over the life of it. So each increment doesn't cost you a boatload of money, but it delivers you a lot of results. And once you start getting people engaged, now you have a continuous feedback loop, and they're going into doing research on this thing, they're publishing papers out of this thing, and they've built an entire community around this thing. Then you can take the whole capability, not only in one place, and take it to the other places, other countries. And you have to sort of think about it in terms of when you're architecting something, because hospitals don't have a lot of money to spend on these things. So you have to have a system that it costs them next to nothing. But then you can't sell advertisement on it either. So you got to think of a model that will work, that doesn't cost without selling advertisement, without selling somebody's names and addresses. And it's not a Facebook. This is the real world. So human stamp. This is one of my personal favorite, because if you are going to do an architecture for something, you have to be able to be convinced, and you have to convince other people there's a reasons why you're doing it. And this is the best movie that I've ever seen in the Invictus. I don't know if anybody's seen it. Is that when you're engaging people, it was about a human calculation, not a political one. There's several videos that I use often. They're on YouTube. You can do them, search them yourself. They're really very powerful. But not, I mean like you follow my videos, but you create your own videos. And one of them is the Nurses on Frontline for SARS. The SARS was an infection that went rampant in Canada several years ago, knowing full well that you might end up getting SARS if you take care of a patient. And if you get a SARS, the likelihood you will die. But that wasn't the problem. The bigger problem was the likelihood if you got exposed, you may not die, but for 4 weeks you're going to get quarantined. You're going to have to go away from your family and everybody else, and you cannot be near anybody for 4 weeks. And that's a big problem. So these people are doing this work. And so now you sort of think about it. So what I did is with this thing is if I put a human face to it, so why we're doing it. And again, it comes down to engaging people. You're trying to get them to the right-hand corner because that's the only way you can get people motivated. Here's the two videos if you ever wanted to see that I use these things often. I make everybody who ever asks me a question, say, why am I doing it? Send them to those two videos and it motivates them, that teaches them and say, why am I doing it? The next thing question comes down to is that, how do I join you? How can I help you? You'd be surprised how often people said, how can I help you? So professional accountability. Architecture is not about drawing boxes and arrows. Architecture is about delivering change that matters to people. So there was an article in the Harvard Business Review several years ago. It said, the meaning of your life. Measures your life. It was basically an article that describes that write up a strategy for your life. And so what that basically did is that it gave you a professional conduct and saying, what is your professional ethics? What are your personal ethics? Whether those personal ethics are spiritual, family, religious, it doesn't matter where your ethics come. What's your code of conduct? How are you going to live? And this was probably the most powerful article that I ever read. And at the end of the day, it sort of gave you a step-by-step instruction creating strategy for your life. What is going to matter? So I went through that whole thing and created my own tombstone. And so by 2052, when I die, which I plan to die at 2052, so this will be my tombstone. And this is one of my father's favorite saying, is to pursue something so important that even if you failed, the world's a better place because you tried it. So we have a responsibility, and our responsibility in this whole project is to building a capability to deliver health information across the continuum under $1 in this whole architecture. And we know the boundaryless information flow is the right strategy. So now we know what the architecture is, we know why we do it, and we know what the strategy is, and we know how the right stakeholders are. We do it piece by piece. It's a matter of time. Now going back to what did we learn from doing all this work? I've been at this thing, by the way, for 3 years now. And there's no sight in the end, there's no end in sight, but keep plugging away at it. So if you're going to work in the healthcare industry or any industry, you need to understand that what works for them. And one of the things that I learned in healthcare is that because the healthcare people who go into healthcare, generally these are A+ students. These are not C students who go into healthcare. The doctors and nurses and pharmacists, these are A+ students. That means they are very, very smart. And they are precise. If you're not precise for what you're doing, you summarily get dismissed. First, you're from outside. Secondly, your language they're using is so loose that doesn't make any sense. They are not going to waste their time reading a C+ material. Either it's an A+, or it's not. They're not going to bother with it. So you got to go with the A game every day. And the people in the healthcare are generally trying to do the right things. They just don't have the delivery mechanism. So this is where we, as architects, have a responsibility to help them, because we know how we know how information flow works. That's something we know. We know how to deliver information to the right person in the right channel in a secure and a reliable manner. But the things that you find out in healthcare, especially, this my experience has been, is that they don't have these simple disciplines like strategic planning, project management, ITSM, SDLC. Those disciplines don't exist in healthcare. So they are being pressured to change that whole industry without the skills that they have in there. They are very, very good to take care of you if you're in the operating room. They know exactly what to do. And Dr. Atul Gawande was pointing out, and he says, today advances in healthcare has moved so far, we can nearly cure every disease that is known to mankind. So they need a delivery mechanism, and they don't have a mechanism how to change the healthcare industry. So we have a response. We know how to do some things, but if we don't know the healthcare, we don't have their respect or the trust. So we got to build those things. And that is a part of the architecture. How are you going to get invited yourself to the table? And you have to be cognizant of that. Industry is changing. There's a lot of people in this industry, and they have a solutions that make them a lot of money. So they're going to be uphill battle. So don't think it is going to be easy. So if you wanted to do something, whether that enterprise architecture is for a whole industry, or you're doing it for something small, challenges are the same. It's just a different volume. Secret to success is honesty. Being honest and being professional. And aligning yourself that we are all at the end of the day trying to improve human progress and justice. That's what your architecture lines do. If you can align your thinking to somebody else's, you get after you get a crowd. So honesty and professionalism. It's not enough to say, this is what I do. That you don't draw your box first and do within your boxes. That's as far as I go. In enterprise architecture, what we're doing is this not a box that somebody else drew. You drew the box around the whole problem, and that's the box that you work in. Your takeaway is understand TOGAF, particularly understand TOGAF partitioning, strategic, segment, and capability, and learn how to apply ADM to those partitions. I have still seen about 12 to 80 years later, to 2004 to 2013, it's about 8 years, and we are still applying ADM inconsistently. Genuine engagement. And engage people genuinely. The problem that you're solving is more complex than you think. Solution to the problem is very, very simple. If you get the right solution. You know when you have the right solution because it just flows itself. There is no organization change management required if you deliver the right solution. People just accept it. And so now, you know, that in the healthcare system, they've been trying to implement electronic health record systems, and it's forcing people to use it. Now, if it's the right thing to do, why would you have to force people? How many people force their people to use Google search engine? It's easy and useful, it works. Professional ethics is your responsibility. You need to have your own professional and personal ethics, code of conduct that you can live by. If you live by it, people will notice it. Do your action plan. Understand TOGAF, learn how to apply it. We're going to do a workshop this afternoon. So we're going to go through the workshop and then learn how to apply TOGAF to those three pillars that I talked about, strategic and segment and a partition and a capability. So if you're interested, come on down. It's a workshop. It's not a sit down and take lectures. It is an active engagement. Hopefully by the work that we do this afternoon, we'll generate some new knowledge that could be shared with lots of people out there. Thank you for your time. I got 6 minutes for questions. Looks done.
Thanks.
This is enterprise architecture, ladies and gentlemen. Solve the whole problem.
Thanks for the wonderful presentation, Jason. I think, and I would assume that everyone in the forum would be envious to the kind of work you're doing. You are in touch with people on the ground, and you're doing something which appeals you. But in a typical engagement, IT engagement, you can't go down to that level. That's what I have seen so far. The kind of staff engagement which you talked about, can I draw parallels to the gamification thing that is coming up and catching up in enterprises. Do we also suggest gamification to engage and leverage with our users to get better requirements? What are your thoughts on that?
I can give you sort of thoughts around about gamification. Actually, if you think about it, a gamification approach is actually working very well to engage people. So gamification doesn't mean that you're going to go play Wii or Xbox. So, gamification could be a whole series of things. The principles that we borrowed about creating a reward system for people is around gamification. So it takes the same gamification principles of an engagement, because to do games, there's certain principles that you follow, but if you follow the same principles, we create a reward system. So basically what we did is in this thing is that there are about 32 things people do in their daily day-to-day work. So each thing that they do, they get rewards from it. So when they hit certain rewards, certain jackpots pop up. So that's basically what people are getting into. And what at the same time is that gamification cannot have negative consequences on people. So if the motivation is an engaging workforce, and by letting people do their job, and during the job they can be part of the gamification, it's a win-win all the way. Like we have given out in last quarter, we probably given out about like $5,000 worth of points. Now, $5,000 buy a lot of lattes and a coffee. Now, what organizations who used it, what they got in return from that people's engagement, that $5,000 investment is trivial what they got results for. Like there's probably 100,000 times ROI on that. Because if you reduce one pressure ulcer in a hospital, because here's how it works. If you go to a hospital, you get a pressure ulcer that you didn't go in there with. Now you as a hospital have to pay for it. You have to take care of that without government paying for it. One pressure ulcer, stage 2, costs $32,000 for a hospital to take care of it. Think about it, what you can do. On the average, in a best-run hospital, they have about a 2.3 pressure ulcers, and a poorly run hospitals have a 10 per person. So if you can bring your average from 10 down to even 6, you reduce per person pressure ulcer by 4. 4 multiplied by 35,000. And think about how many patients that you have, 500-bed hospital. So think about the number. It's just an astronomically ridiculous number at the end of the day. All you've done is given somebody $5,000 worth of coffee. And the gamification worked. So you have to think about it, apply those principles to how you're going to engage people, and gamification is a great strategy.
Morning, Jason. Jason, you mentioned in the architecture, enterprise architecture, we need to have everything in the scope. There's nothing out of scope. It is out of scope. You don't have to mention on a piece of paper or something, right? But let's take an example of emerging markets. When we design an enterprise architecture for an emerging market, things don't fly away easily with the business. They say, and I'll give an example of agriculture industry. If you try to design an architecture for Indian agriculture industry, the customer or the business straight away shot down a lot of approaches that as an architecture you want to propose because of the process, people, and ground realities. So in traditional way, we give them a solutions or architecture in terms of short-term and long-term approach. Is that the right way to do it? Or do we have a different things, we force them to include what we are suggesting and not go for a short-term, long-term?
Well, there's a couple of problems. Is that if somebody's not buying what you're suggesting, then maybe it's what you're selling. It may have something to do with it. I'm not saying that's what it is. But the thing is that the short-term and long-term, those things are perfectly valid approaches. Like in engineering, we used to do is say, what can I do at no cost? What can I do at no disruptions to the operation? There's still things that you can do. So the same in TOGAF, when we create transition architecture, in the transition architecture, there has to be a transition that you can implement without cost. And rarely do we ever think about a transition architecture without a cost. So if you are taking, the part that I wanted to make sure that we're clear on is that not everything is on the table. In methods that we have, we call an enterprise. We define what enterprise means. So if you take the entire Indian continental agriculture system as your enterprise, then you have to think about it, what problem are you solving in it? Because the problem that you're solving, if you go back to system thinking, what are the salient characteristics of the problem that you're solving? It may have very little to do with the problem that you think you're solving, because the person on the ground has a slightly different set of problems. There was a very good book written by Professor Roger Martins from the University of Toronto. It's called The Opposable Mind, and he goes through 20, 30 examples how people use the system thinking to radically change industries and people's mind and organizations. Simple solutions, but just radical changes.
Jason, from our experience, we find that the internal champion, the leader in the organization, if you don't have a kind of an internal leader, who's going to actually take it up passionately, enterprise architecture projects fail. So, you have any comment on that?
I don't know about that internal leader. You are a leader, whether you're internal or you're external. Start acting like one, you'll get treated like one. I don't think that I need an internal leader to convince that we need an enterprise. They have internal leaders, but you are a leader too. So I don't buy the argument that somebody has to lead me in order to do something. If what I'm proposing, whether I'm internal, very often if you're doing the right things, you're behaving right, ethically, at professional way, people won't even know that you're internal or external. So I don't think that it's as much as you need a leader. You can cultivate leaders. People who are leaders are also good followers. So if you get good followers, they're leaders too. In enterprise architecture, we're going to talk about this afternoon, is that as an architect, you're not in charge all the time. So sometimes leading from behind is more important from leading from front. So I would suggest is that don't wait for somebody else to lead. Lead yourself. Start leading yourself first, and then others will follow you. And the suggestion that I made to you about in your takeaway, if you look at that article about creating a strategy for your life, if you have a strategy for your own life, and you're following it, and you're executing it, as you outline strategy for your life, that you are probably a good architect too, because if you can lead your own life, how can you lead something else? It's a good test as a sample. Create a strategy for your life, start living it, and then you start living everything else after that. If you can't live the first part, then don't worry about the second one, because you aren't cut for it. Not everybody's an architect. That's okay.
Jason, question here. Okay, I have a question on your comment on the bringing down the pricing from $100 to down under $1. Well, it sounds exciting to me, but what about the quality? So if you are trying to bring down the cost, aren't we compromising on the quality? Are we providing good quality services then?
I don't think the quality is in this case, is that there's a certain accepted quality in healthcare. Less than that is just not acceptable. So I don't think that you can compromise on the quality in order to get the cost. The quality is fixed. If somebody's 100% of the record isn't known, there's no point of having a 75% of health record. So that's just a given. Because what happens if you only got a 75% of health record of somebody is how do you know what's missing? In healthcare, what they do, unless the doctor in front of him has the entire file, if he doesn't have the entire file, if there's something missing, he will summarily dismiss the file and go down to the patient. Because he has no idea what's missing. So he can't trust anything in there. So healthcare is one of those things that 100% information has to be right.
Yeah, excuse me, Mr. Jason. I have one question here, this side. What is your suggestion regarding how this particular architecture can improve the Government of India's health sector? What is your suggestion, or how somebody can convince that how this particular thing can improve because there is a problem in the Government of India's health sector. If you go any government hospital and see how their processes are running and how they are managing, so how your architecture will help these government hospitals, their processes in improving their healthcare
Right, because one of the things that what we have is that there are a number of studies that exist already. Because one of the things that healthcare is very good at reading evidence. Like, prove me that this thing works. So providing evidence-based practices. That's one of the standard questions that you get to say, what makes this a good practice? Show me the evidence for it. So there is evidence around is that if you have an engaged workforce through these kind of things, and what they did is that in a number of research centers, they looked at engagement of workforce and pressure ulcers. And so by having this level of engagement, this is how you can reduce the pressure ulcers. Now they did a very primitive engagement of methods to engage people, because it was a very controlled study. And so if you take a look at that, engagement improves quality. We can establish that connection. So the next question becomes, how do you scale that learning to global setting? So that's a challenge. Is this the right architecture? I don't know. It may work for US, may work for Canada, may not work for Middle East. Because the cultural difference, or in China or India or somewhere else. But there has to be some tweakings to it, because principles are the same, except what's important.
So you mean to say there has to be a study on this? And
this is what we're doing. We're doing studies for this thing, is that because we have a limited initial studies that show the linkage, but now we have to replicate that study at a number of different cultures and countries and hospital settings to validate that how much does it improve. Because in one place it might go from a 10% to 3%. Or might go from 10% to 7%, but it's still a hell of a lot better than going from 10% to 7% than going the other way around. Because one of the things that what you do when you architect something like this, you know the cost of it. You keep the cost down so low that is implementable at a click of a finger. So think about it, is that 15 years or 20 years ago, whoever thought it was a Gmail or Yahoo Mail would be free. We used to pay for AOL mail. All of a sudden, Gmail or Yahoo comes around and gives it for mail for free. So these things work, but we don't know what's going to work until we try something. That's why they're running 1 million trials a day. That's basically what it is, 1 million trials a day.
Thank you.
One of the challenges for enterprise architects is to balance between the long-term and the short-term important requirements, right? So what are your tips on how do you balance between these two? Because sometimes you are seen as trying to boil the ocean. At the same time, they have immediate needs, which when you try to address, you may not be aligned with the long term. So how do you align as well as balance between these two?
Yeah, but that's kind of what I'm trying to point out, is that if you think about it, do the architecture for the whole thing, but think about it, what's the minimum acceptable viable thing, and run with it, and then you incrementally add to it. If your architecture is incrementally and linearly scalable, then you got a good architecture. Because if it's mean every time you increment this thing, you have to throw the whole thing out, then it's probably not a very good architecture. It's one of those, like, I'm not concerned as much about long-term and short-term, and I'm concerned about what can I deliver. Like, one of the things that I look at in architecture is that what can you deliver in 30 days? What kind of impact can you make in the organization in 30 days? If the answer is nothing, then you probably have the wrong architecture. You know, this approach isn't like this. We're running out of time, so we're going to wrap up. This approach of short-term, long-term thing is that you have to sort of think about it, what it is that we're doing. When I was an industrial engineer, first starting my career, when we were identified, we were going to study a certain process in the factory. And first thing we were asked to do for the first day that you're going to do, when you got a job, you're going to go there and get the place cleaned up. Get a place cleaned up, make it safe for people to work. Within 24 hours, people notice the difference. Almost always, productivity of that line went up by 10, 15, 20%, depending on how dirty it was, just by cleaning it up. That's a short-term delivery. That's the short-term enterprise architecture. You improve the process aspect without doing anything. And at best you did is somebody doesn't get hurt anymore. That's architecture. You know, do something short immediately that you can make immediate impact. All right, thank you very much for your time, and hopefully it was worth it. And be around this afternoon. Any questions and comments, please feel free to share. Thank you.
Wonderful. Thank you, Jason. So the core message is all about believing in doing it, and once you begin to believe, you know you can get it done. So
that's the 3/4 of the battle, is that if you believe you can do it, then you can actually, if you set your sight to it, who knows, might succeed at it.
Cheers. On that note, thank you.
Thank you.
Just 'cause everybody doing what they all do. If one thing I know, I fall but I grow. I'm walking down this road of mine, this road that I go home. So am I right?